Hey guys, I'm Dr. Desai. I'm the Chief Medical Officer at Osmosis. I'm also a pediatric infectious disease doctor, and I used to work at the CDC doing work with the Division of Viral Diseases. And part of my role there was to investigate outbreaks. So with COVID-19, it's kind of the confluence of a lot of my interests. And I'm here to do an Ask Me Anything. You can just put questions in the sidebar, and I will do my best to answer those questions. So go ahead and start with that. In the meantime, I'll start by just talking a little bit about some things that you can do to contribute to beating COVID-19. And actually, while I do that, I'm just going to take a sip of water to ease my own bit of a cough that I've had. First and foremost, do what I do. Stay at home. Don't go out if you don't need to. And minimize your trips out. So, for example, try to grocery shop once a week or once every other week if you can, rather than going every few days. Every time you go out in public, you're putting yourself at risk. You're putting others that you love and are around, like your family, at risk as well. So try to minimize that as much as possible. There's this idea of flattening the curve. And what that means is that basically the number of cases that we see are reduced day by day. And that's essentially kind of flattening. What we were seeing initially in the exponential phase of this is that we were getting more and more cases. And so that's the idea. Now, what we're going to need to do is not equate flattening with winning. You know, there's this quote I heard recently, and it was kind of an interesting one. Basically, if you're free falling and you've got a parachute, and let's say the parachute is slowing your descent, so that's good, right? You don't cut the parachute until you've landed. You don't say, well, you know, I'm going slower now, so I don't need this thing anymore. You don't do that because, of course, you're going to end with a disaster. And same thing here. When the curve is flattening, you don't want to ease up on things like isolation because that's the last thing you want to do right now. You want to keep it going until the number of cases is so low that our public health system has enough testing to quickly find those cases and get on top of them. And what I mean by that is they would literally isolate those people, call all of their contacts, isolate those people and make sure that they're on quarantine, and basically make sure you do isolation then surgically, kind of just isolating the cases and their contacts rather than isolating the entire community, and in this country, the entire country. So that's the idea behind why we want to make sure we keep flattening, keep isolating to the point where the cases just really trickle down to nothing. Next, if you take a look at our pledge, you can sign it, get 3 free weeks of Osmosis Prime. It basically says, are you going to do those basic things? Like if you're sick with mild symptoms, stay home, please. Don't go to the doctor's office and you know, make them basically use the resources on you when you're essentially having just a mild illness. Wash your hands, minimize your trips out, things like that. All right, there are a number of things that we've talked about in recent weeks related to COVID-19 on my daily updates that I thought I would just give you some quick updates on here. Very quickly, splitting ventilators. There's a huge number of societies that have basically said, no, don't do that. It's not a good idea. However, there are now FDA-approved tools that you can use to split ventilators that allow for specific management of physiology. So you can actually take care of 2 patients at the same time, even if the 2 patients have different disease states, which is a big deal because previously that was hard to do or impossible to do with the ventilators that we had. The next thing is talking to your kids right now about this sort of very unsettling time. That's a very hard conversation. We had a podcast with Dr. Patrice Harris, the president of the AMA, the American Medical Association, had a wonderful conversation with her, and she gets into this because this is a passion project for her. It's her area of expertise as a child psychiatrist. There are a number of masks that are out there, or questions about masks also. I just want to touch on that quickly. We do have a daily video update on masks that you can take a look at. It basically gets into what a homemade mask could be made out of that has been studied to actually minimize transmission of virus. The virus they looked at wasn't SARS-CoV-2, but it was avian influenza virus. But actually, the homemade mask with polyester and essentially kitchen towels on the inside minimized the transmission of the virus by about 95%. So very, very effective mask. And it was breathable, and you could take the kitchen towels out, throw them away at the end of the day and put new ones in. And again, you'd only be using the mask if you go out on a trip, like going to the grocery store. So you wouldn't even necessarily need the mask when you're just at home, unless you have symptoms and you're trying to prevent someone else in the house from getting those. So that's one big thing. Also, there's a daily video update I did on N95, so take a look at that. Essentially on that one, very quickly, you can sterilize an N95 mask by putting it in the oven, believe it or not, and the oven would be a industrial grade oven at the hospital for about 30 minutes, and then letting it cool, obviously, so you don't get it too hot on your face, letting it cool. And you could do that 20 times without the mask breaking down. And that was an effective sterilization technique. So I know many people are wondering how to get more N95s. Maybe there are hospitals out there that are struggling. This is a very easy way to recycle N95s, and there's a Stanford protocol on how to do that. So those are just some general questions I wanted to answer. Let me just kind of dive into the questions here. And let's see if I can go through the most important ones. So starting with what happened with the vaccine today. There are a number of vaccines, over 50 vaccines out there that are being studied at some level. There are 5 or more now vaccines that are actually in phase 1, phase 2 trials. I did a vaccine video, so you can go watch that in detail, talking about all of the different vaccines that are out there. But basically, the ones that are out ahead are using a technology. Some of them are using a technology where they one of them introduces DNA, and that DNA is taken up by the cells, and those cells start making protein, viral protein, against spike protein. That's the main virus protein that's out there. And then when you react to it, you generate a really nice T cell response and B cell response. And that immunity is thought to last for ideally years. And that's based on other coronaviruses where immunity to the vaccine lasts for a few years at least. So that's a big question right now. Looks like vaccine is not going to get here until 2021. So we have a long ways to go till then. But there are vaccines that are out there that are being studied. And again, they're right now in the safety stage, just to make sure they're safe. And once they exit that, we'll look at the efficacy stage. How effective are they? Next question, are you okay? How are you feeling? Feeling pretty well, just a bit of a cough. Can you tell us, next question, can you tell us if the genetic makeup of COVID-19 indicates it may have originated in a laboratory? There's a lot of questions about this, and I want to address this head on. The virus, as far as we can tell based on all the science that we have, is a coronavirus that is from bats. I'll say it again, it's a coronavirus from bats. Bats have lots of coronaviruses. This is likely one of them. And I say likely because there might be an intermediate host. At first it was thought to be a pangolin, which is another animal, but it also well could be just directly derived from bats. There is no evidence, say it again, there's no evidence that this is from a laboratory or man-made or anything like that. So this is a virus, and this happens, right? Because we live with animals, we get animal viruses, and this has happened 2 times previously with MERS and SARS. This will likely happen again with other viruses that come from bats. So this is something we should just, as a society, essentially learn how to deal with really effectively and learn how to contend with, both in terms of prevention, flattening the curve, but also raising the line, which is essentially saying, let's get more healthcare capacity built out so that when we have surges of cases, from whatever cause, we can deal with it effectively. All right, should we start wiping down groceries with disinfectant? So in terms of fomites or objects, this does live on, can live on surfaces. It can also linger in the air. So what I would say is that it's best to, if you can, minimize your trips out. When you do have to go out, wear a face covering. I talked about the polyester with kitchen towels. Wear something on your face that prevents you from either spreading it, if you have it, it's called source control, or catching it. So when you have something on your face, you're less likely to touch your face, less likely to also get it directly, especially the one that I described, because it does have some filtering capabilities. And so try to do that. Also, of course, protect your eyes as well. And when you bring home groceries or boxes that you might get from Amazon or any sort of shipments or anything like that, it is a good idea to go ahead and wash your groceries just as you would normally, and also wipe down surfaces and get rid of the boxes, and then wash your hands after that. These things keep you as safe as possible. The fact is, the most likely place you would get it is directly from another person. So the most important thing is just minimize your trips out to be around other people, and don't go socialize or do any of those kind of things. But if you want to be extra cautious, extra judicious about not getting it, definitely wash your food, wipe down surfaces that come into your home as best you can. So that is the recommendation on that. Why can't we stop the pandemic? Well, I will say that in the US, the numbers have flattened, But again, they haven't gone down dramatically. And in some states, they're actually still going up. So let's compare Washington to Wyoming. Washington was one of the first states to get this. They're definitely on the downward trend of this. Wyoming is one of the last states to see this, and they're definitely on the upward trend. So you have a difference in terms of regional variability because of the fact that some states just saw this early versus late. This can be stopped. So let me be very clear. This can be stopped. We simply need to isolate and make sure that people don't mingle too early before our public health system can kick in and do the testing they need to do to quickly identify the cases, so we don't ever get in this situation again where we all have to just lock down, which will happen if we de-isolate too early. Next question. In your opinion, when will COVID-19 disappear? Could the low mortality rate be an indicator that the curve is flattening? So as you do more and more testing, you see more and more mild or asymptomatic cases, and therefore the mortality rate will look better and better and better over time because you're not catching just the severe cases, you're catching more than that. So certainly as you see more cases, the mortality rate will naturally go down. That's pretty normal. Having said that, in terms of when this will disappear, if we consistently isolate, let's say we don't change anything, the stay-at-home orders stay in place, and people follow those orders, of course that's a big if, but if people follow those orders and don't go out there and mingle and hang out in big groups and protest and all that kind of stuff, if they're not doing that, then honestly, I believe in the next 6 weeks or so, maybe even now 5 weeks, we probably could get to a place where most states, not every state, but most states can probably take care of the remainder with a robust public health system and a lot of testing. So the two things we would need there is continued isolation for the next 5 weeks or so, or 6 weeks in most states. And then in those areas where you're seeing a downward trend, and that's what you'd have to see, in terms of cases, we'd have to have more testing to be able to catch the number of folks that are left, and the fact that we're going to continue to see cases, right? They're going to continue to come in from other countries, other states. So this is going to continue to kind of happen from time to time, but you want to see a ripple in terms of, you don't want a big surge of cases. You want to just see a little bump of cases, because the moment you see one or two, you want your public health system to be so strong that everyone is jumping on it. They're calling those 2 or 3 people that are sick, calling all their contacts, isolating, quarantining, and that it never really explodes the way that this has exploded in our face. Next question. How can a med student become a good doctor? Good question. I suppose the biggest piece of advice I would offer you right now, and really going into the future, is empathy. Do your best to try to empathize with your patients, especially during this time, where there is, of course, a component of this that is biologic, in the sense that if a person is sick, they're not feeling well, there is a science piece of this. There's also a huge part of this that is just essentially the social component of this, meaning the anxiety that comes along with this. When a person goes in right now to a hospital with COVID-19, they're isolated from their family, they're not able to see their loved ones, they may feel very, very lonely. And so there are two big different kind of issues to tackle there. The issue of how do you make them better, and also how do you make them feel better while it's happening and make sure that process feels smooth. And I think being a good doctor is about balancing both of those things. How long can the virus stay on surfaces such as paper, plastic, or cloth bags? It really depends on how much virus landed in the first place to tell you how long it's going to live. So in general, the studies show that if you put some virus, and the amount can vary, on a surface, it'll last there for usually hours to days. And it really depends on the surface. Is it porous? Is it non-porous? Things like that. But that's why people are getting so thoughtful about cleaning surfaces, is because it does live on surfaces for hours to days. In our country, some doctors who are COVID positive had no signs or symptoms. How is this possible? And what should we do as doctors? Well, I'll say that generally speaking, if you're in a place where doctors are getting sick, that is likely because those doctors are not getting protected properly. So in many places, PPE, or personal protective equipment, is lacking. So as best as possible, we should probably be looking out for them. Like I mentioned, the recycling thing, that's a very immediate solution. There's also the fact that a lot of doctors simply, when they're going from patient to patient, might be forgetting, or might not be putting the mask on correctly to begin with. So if you notice something like someone has facial hair, or they're not getting a good seal, that's something to flag for sure. And there's also this idea of getting a checklist in place, making sure that, for everyone that's getting ready to go in to see a patient, that somebody else is watching them, gown up, glove up, etc., so that they're fully protected. And simple things like a checklist just to watch them get ready is very, very effective at making sure that people minimize the risk of getting sick. All right, next question. Is a disease only infectious when symptoms arise? Nope. There is a lot of evidence now that you can pass this infection from one person to another before you have symptoms. And so let me just be very clear about it. You may have no symptoms at all, and you can still pass it. And the way that you would do that, two big ways. One, talking. So you can actually see bioaerosols as you speak. The virus is in the tiny little water droplets that are coming out of my mouth and nose, and that's getting into the air around me. Number two, touching my nose, touching my mouth, touching my eyes, and then touching objects around me. So you literally can take the virus that's in the secretions and then start spreading it around just through touch. So those are the two big ways that you can spread it without having any symptoms at all. Next question, is CPAP a viable treatment? Certainly, there are a number of things you can do for someone that's in respiratory distress. It starts with oxygen. So you can give oxygen low flow by nasal cannula. You can give high flow nasal cannula, so just putting kind of prongs in someone's nose and let the oxygen blow in. Those are the two easy or first steps you would take. And then if that's not working, bigger steps you can take would be like continuous positive airway pressure, or CPAP, where it literally is kind of blowing air into someone. Beyond that, you might even consider intubation, where you actually literally put a tube down someone's throat and you're inflating and deflating the lungs mechanically. So those are all things you can do, and it's a spectrum. And typically you want to do the least intervention, or the least invasive intervention as possible. Next question is, let's see. In my country, we're considering lifting the quarantine gradually. Right now we have 5,000 cases, but per day we have more than 100 cases. Is a good idea to lift quarantine. Lifting quarantine gets down to two issues. What is the projected or predicted number of cases, and what is your testing capacity? So how many tests can you run in a given day, and how many cases do you think are out there? And then things like, how many human beings do you have in your public health team that can pick up the phone and make phone calls? If I tell you there are 1,000 cases in a certain area, and you have all the testing in the world, but it's just you, that's a lot of phone calls to be making, right? Because you have to call all 1,000 people, get a list of people that they've been around in the past 2 weeks, and call all of those people. That's a lot of work, a lot of phone calls. So you really need a big army of people that can do all this work and make sure everybody that's out there is adequately quarantining and isolating. And until you have enough personnel, and until you have enough testing to identify all these people and test all these people, you shouldn't be loosening restrictions around stay-at-home orders. Next question. What is COVID-19's effect on the supply chain? Well, as I'm sure you know, most things in the world are not made in any one location. And in fact, this has become very obvious with testing. So a simple thing is, people say, well, why hasn't testing ramped up? And you have to think about it. Well, you need a swab, you need reagent, you need a pipette, you need a little tube to put the pipette and the reagent into. All these things come from different locations. And so it may be that the swabs are made in country A and the reagent is made in country B. And so what we're trying to do is actually create a possible Band-Aid solution in some cases. Like maybe you can make the reagent yourself. In fact, the CDC did this. They actually put out a recipe for how to create transport media, where a lab can just kind of make their own transport media instead of waiting for it to arrive from the CDC. But now to make the transport media, you need more ingredients. And so where do those ingredients come from? And maybe those countries are unable to get those exports out. So it's really, really shown us that having any one country affected really affects all countries, because we're so interconnected with our trade that you can't really take care of one group of patients without making sure that all patients around the world who are workers in companies and factories are all adequately cared for. Next question. DNA and RNA vaccines versus protein vaccines or protein viruses. All right, well, I will try to work out what I think this question is getting at. There are a number of vaccines out there. Some, as I was alluding to earlier, put DNA into cells. Others put mRNA into cells. Others use virus vectors like adenovirus or lentivirus to get the RNA or DNA into cells. Lots of different strategies for how to get RNA or DNA that encodes the viral proteins into cells. And right now we're essentially using a mix of strategies, and we're going to see which one seems safe but also seems effective. So all these kinds of things are all on the table, and many, many others that I haven't even mentioned, in terms of what vaccines are using as a strategy to get virus protein, and again, it's the spike protein, that's the name of the protein, into your body so you can see it and mount a response to it, so that when you see it in the real world, let's say, the COVID-19 infection comes your way, you'll have an immune response to it. All right. Why is vaccine development taking so much time? I'll be honest, vaccine development takes much longer usually. So this is a very accelerated pace, and the big issue here is safety. So what they're doing is they're trying to make sure that these vaccines are safe and effective. And right now we're in the safety phase for most of these. And that usually takes time because you have to get a sense of like what are the baseline number of adverse events that people are reporting. And then down the road, you're going to start seeing, does this actually even work? And these usually take, 18 months would be lightning quick. And, I know that timeline obviously it feels long right now, but that's why there are some ideas around how to shorten that, but that's a pretty normal timeline. Why does COVID-19 affect some people more than others? That's the million-dollar question. You know what makes me really, really happy about COVID-19? It's the fact that it doesn't affect kids nearly as badly as it affects the elderly. Can you imagine for a moment what the conversations would be like if we saw the mortality rates in under 1 and under 5 like we do in the over 60? We would all be a very, very different kind of, it would all be very different in terms of our aggressiveness around isolation, our levels of panic, our levels of fear, all those things. And so I feel very grateful that for whatever reason, it's not fully understood, but that kids are really doing quite well with this disease, even though we know that there are many, many kids that have been infected with COVID-19. Next question. Can you talk about the coronavirus strains? Absolutely. So there are many strains. There's a website called nextstrain.org you can check out that shows you all the clods of virus and all this kind of small mutations that have happened. Basically, the current issue is the spike protein is not that different between all the different strains. What that means is that when you mount an immune response to that protein, like I've been talking about, you basically are effectively immune to all the different strains that are out there. Because again, that protein is the same for most of them. So that's one key thing to know about the different strains, is that our immune response is going to be effective across strains. Next question, can you talk about immunity to COVID-19 specifically? I'm 3 weeks post-positive, and will need to go back to work soon. I'm really nervous about reinfection. Great question. So if you've had COVID-19 and you've had it for, and you're 3 weeks after having the positive test, I'm guessing you mean positive RT-PCR wise, meaning that's the direct test looking for the actual virus RNA. There's also immunologic tests that look for whether you have an immune response. And what I would encourage you to do is see if you have an immune response. And specifically, not just do you or don't you, but if you can get an ELISA test done, that's not just qualitative, which is yes or no, you have an immune response, but quantitative, meaning it would be ideal for you to see if you can get a quantitative ELISA test to see what level your antibodies are at. There are some early data saying that the titer that you want to aim for would be above 320. So that means that the antibody levels are quite high because you have to, that's essentially it's a dilution. So the higher the number, the more the antibody. So what I would suggest to you is identify and learn about your own immune status. How immune are you? What is your IgG level, or what's your IgM level? And if it's above 320, that's pretty, I would say that's pretty good. It gives you a lot of confidence that you're likely immune at that point to getting it again. And these stories that we're getting right now about reinfection, out of other countries, I have a whole video on that, and you can go check it out. It's on how long does immunity last. But basically, the nuts and bolts of it is that those countries are likely reporting on false negatives and false positive cases, meaning the RT-PCR test probably misreported a person's status rather than the person actually getting the infection again. So I just want to make that very clear. So if you had the infection and you're worried about, going back to work, assuming you have a normal immune system, this is why I'd want you to check it out. And assuming that you have a titer above 320, that gives you a high degree of confidence that you're not going to get sick again. Next question, for a vaccine to be available, what process does it have to go through, and is the process even longer than making the vaccine in the first place? Making the vaccine in the first place is, in many cases, we've seen a pretty short process. Some folks did it in less than 2 months. So what that tells you is that the real lift is the testing phase. And that's where we're spending 18 months or so. And what we'll probably see is that that phase will have some creative solutions. There are some ideas out there already. You can look up human challenge trials. It's something I'll be doing a video on very soon. But it's an idea around how to help expedite the testing phase in a way that still feels ethically fair and just, but also will give us good data and learn whether these vaccines are both safe as well as effective. All right, so I'm going to take that moment to take a pause, mention a few things to you. We actually launched our podcast. I got a chance to speak to the folks in the leadership at the CDC, the folks that used to run, or the gentleman that used to run the CDC, Tom Frieden, and shook it. I mentioned Patrice Harris. So a few really key leaders in the medicine space and the public health space. So go check out our podcast. I think it's really wonderful. Also, we launched our song. And so if you haven't checked it out, go sign our pledge. You can listen to our song as well. And again, you'll get the 3 free weeks of Osmosis Prime. A lot of the questions here have also addressed things that I have talked about in our daily video series. So if you want a deeper answer, go check out the video series. I have all the references there, so you can go check those out as well. This Saturday, we spoke briefly about empathy, and part of that is understanding that this is not just a physical disease, but affects our mental health. So this Saturday, we're going to be doing a yoga session live. So please check that out, and it's about trying to get the other pieces of COVID-19 wellness in place. We're going to be doing this again next week, and Ask Me Anything. So if you have any questions that were not addressed today, please come with those questions. And then if you have general questions that maybe we haven't touched on, or you're just wondering about, go check out our resource page. We have that at osmosis.org/COVID-19. We even have a course that you can take on COVID-19 if you're curious. That gives you CME credits. And again, just remember, Osmosis is here to have your back. Please be well. Thank you so much.